Welcome to Women's Health. Hi, I'm Jeanne Schumacher, co-founder of the Pregnancy Advantage, where we help women to get their bodies pregnant ready. Or if you're having trouble conceiving, then we can hopefully help you there too. My partner is Dr. Debra Shapiro, who's a board-certified OBGYN. Today, we're going to be discussing something that I really never thought about in the day and age when I needed them, and that's tampons and how they're made. I mean, to this day, if you go out and buy some mascara or shampoo, it's got a list of ingredients, but not your box of tampons.
The reason we want to talk about tampons is because of something that happened back in the 70s and 80s. And if you're of a certain age, you will know what I'm talking about. And that is toxic shock syndrome. And toxic shock syndrome is a very serious, life-threatening illness that was discovered happening to women who were using certain kinds of feminine hygiene products, particularly the tampons that were the super absorbent tampons, and they were leaving them in for prolonged times. And so I wanted to talk a little bit about what toxic shock syndrome is. We don't hear about it so much with regard to tampons, mostly because those types of tampons with the super absorbent fibers have been removed from the shelves. I don't know whether you can get them in other countries, but this is certainly a warning, and we'll give you some ideas about safe use of tampons later. But basically, a tampon is, the tampon actually has a word in medicine too. It's just, because we talk about tamponade, but it's something that you can put up against something. So it's a little, usually a cotton type of object that would go inside with the cottony fabric object that would go inside the vagina and would absorb the blood from your menstrual cycle, and then you'd be able to pull it out and replace it. And I remember women coming to me, this has probably happened to some of you out there, where you forget that you put one in and then you put another one in and then you only remove one. And so there's one in there, and you develop this terrible odor, and you go to the doctor and quite embarrassed, and we go in and fish out a little tampon, and it is quite smelly, but usually that does not lead to any infection, luckily. But there are cases where tampons can cause a very serious infection, and that would be the toxic shock syndrome. And toxic shock syndrome is an inflammatory condition, and it's characterized by rapid onset within 48 hours of very high fever and chills, a diffuse rash, and that's often followed within about 2 weeks of the skin sort of sloughing off. Very low blood pressure, really you can be fainting, and then multi-organ system involvement. You can have renal failure, you can have gastrointestinal symptoms with terrible diarrhea, neurologic symptoms, and of course muscle aches and mucous membrane involvement of your eyes. And so this is usually caused by Staphylococcus aureus, Staph aureus. Staph aureus was the cause of menstrual-related cases of toxic shock syndrome that we found in the 70s and 80s. And there's a toxin produced by the bacteria that plays an important role in the pathogenesis of toxic shock syndrome. It's called TSST-1, or toxic shock syndrome toxin 1. That was the initial exotoxin that was isolated from Staph aureus and that implicated in toxic shock syndrome. And it's not produced by all of Staph aureus strains, but most, 90 to 100% of the strains that were associated with menstrual cases of toxic shock. And also, a lot of this toxin was also associated with non-menstrual cases. You can get toxic shock syndrome after any time that the skin has been breached, after burn cases or after surgeries, when there has been entry of this horrible Staph aureus. And I think some of you probably heard about methicillin-resistant Staph aureus, or MRSA, causing these terrible infections. So the thing about this toxin, and there also are other toxins, there are many different enterotoxins, actually A, B, C, D, E, and H, that also contribute to this inflammatory condition. And some of these toxins, these exotoxins, Staph aureus exotoxins, we consider them super antigens. They actually create, this is so interesting because we can think about it also because it kind of relates to things that we see with the coronavirus, is this cytokine storm. These toxins act in the body as a super antigen, and they turn on your inflammatory cascade, and you release your activated T cells release things like interleukin 1 and 2 and something called TNF alpha, tumor necrosis factor alpha, tumor necrosis factor beta, and this interferon gamma in very large amounts. And so that's what causes the fever. And because these are, they're called pyrogens. You get a fever and you get destruction of your muscle cells, skeletal muscle proteolysis, they call it. And it causes a lot of muscle pain and myalgia. It's a lot of the same stuff that you can see with, because it's the same, the cytokine storm, it's the same idea, but it's caused by this toxin from this bacteria. And the other thing that's interesting about the toxin from Staph aureus that's related to toxic shock syndrome is that it suppresses white blood cell production. So when people come to the hospital, they don't have pain except for muscle aches, but they have a high fever and they're hypotensive and they're, going into shock. But what's interesting is you don't see a high white count. It can be kind of strange because usually when someone's got an infection, their white count's up. So, and also you don't see a lot of pus because you don't have a high white count. Now, also what's interesting is that by adulthood, most people have developed some immunity to the TSST1 toxin. By the time you're sort of an adult, 70 to 80% of adults have antibodies. And by the fourth decade, that goes up to 90 to 95%. However, actually, the toxic shock syndrome toxin-1 antibody titers were lower among African American women compared to white women. 89% compared to 98%. And the other thing that's interesting is that if you develop toxic shock, you don't develop antibodies to this toxin. So just a little bit of more history about the toxic shock syndrome related to tampon use. It was first described in 1978. I was certainly very much alive then. I was 18. And cases increased sharply in 1980. And there were actually more than 800 cases of menses-related toxic shock syndrome that were occurring. And this was associated, though, with the use of these super absorbent tampons. And when we removed those, when they were removed from the shelves, the cases dropped. So, there were 5,300 cases of staphylococcal toxic shock syndrome between 79 and 96, and a steady decline of the menses-related cases because of the removal of these highly absorbent tampons. They had a polyacrylate rayon fibers in them. The women who developed toxic shock syndrome were more likely to have used these highly absorbent tampons, and they also tended to use tampons continuously for more days of their cycle, and they also kept the tampon in place for a longer period of time. So I don't know how many of you are old enough to remember this, and of course now I'm menopausal, so I'm not using tampons, and so this may all just be you don't care about it, but it still is important to remember when you're using a tampon to not leave it in too long. I don't think you should leave it in for more than 8 hours. And be careful of using tampons when you're not really bleeding. I remember using tampons just to feel sort of drier or something. And I know we have all these pads, but pads cause, those little mini pads are also bleached and they can cause a lot of irritation. So anyway, don't use tampons when you're not bleeding, and use the appropriate size. If you can get away with just a slender tampon, then just use that. But don't, you don't have to. Gosh, sometimes because I was still doing dairy, of course, my periods were very, very heavy when I was growing up. And I'm hoping that you are not doing dairy because, it really does increase your estrogen levels and it will give you more bleeding and heavier periods. So I was sometimes using 2 tampons at a time. I mean, it's a wonder that I'm alive, but here we go. I never got toxic shock syndrome, and I never saw it in any of my patients as well. But, there are non-menstrual cases of staph toxic shock syndrome, in surgical people after surgeries and for postpartum wound infections. The perineum is definitely a place that's sensitive to this. Mastitis can also be a source of a staph toxic shock. I mean, you can get, you can certainly have an infection, a staph infection, and a staph, even a cellulitis, and it doesn't become toxic shock syndrome, but it can. And just remember, the signs are the fever and the shock, going into shock, your blood pressure going down, the terrible muscle aches, and the rash. So anytime if you have a sinusitis or if you have surgery on your nose and osteomyelitis. I mean, people have Staph aureus sometimes actually just living. Some people are just carriers of Staph aureus and they have to be particularly careful. And that's something else to think about. Just wash your hands. If you're going to be using tampons, wash your hands before you put them in. When you go into a bathroom and it's interesting, we go into bathrooms, public restrooms, and maybe now everyone's being much more careful than we were in the past, but use paper when you're touching things in the bathroom. And if you're certainly going to be touching yourself with tampons, and the kind of tampons that don't even have those applicators, but I used to use tampons, OB tampons that you would have to put in with your fingers. And, it is just a wonder. I'm still here. But, the case fatality rate for even non-menstrual toxic shock syndrome was 5% between 1979 and 1996, with high rates of mortality in women, whether they're menstrually related or not. So sometimes people had toxic shock syndrome and they didn't even know where it was coming from, which is interesting. And often blood cultures may not be positive, may not even be positive for this. So you make this, I know you guys aren't doctors out there, or some of you might be, but you can't always rely, you can't rely on the white count. You can't always rely on blood cultures. And toxic shock can even occur in children after a skin lesion. And toxic substances that are produced by these bacteria, they cause kidney and heart and liver failure and shock and even death. I wanted to just mention one other thing about an alternative to tampons that I used that I think we probably shouldn't because of the dangers now. But back,
you told me about this. I couldn't believe. I never heard of this one.
Well, okay, I was a hippie, and I hitchhiked a lot. I hitchhiked, and I felt at the time in 1978 that it was terrible to just have garbage. These tampons are like it's like the idea of using cotton diapers instead of these throwaway diapers. I just thought it was creating a lot of garbage, and that I should try an alternative. So at the time, what seemed popular, at least in the Bay Area, was to buy these little sea sponges, natural sea sponges, and you would kind of pick out the little bits of shell that was in them, and then you would boil them, and then you would use them. So I would take the boiled sea sponge and I would push it up inside and collect the blood. And then when I was out on the road, I could go into a bathroom and I would pull, or if I was just camping, just pull it out, rinse it off and put it back in. So within my menstrual cycle, one cycle, I didn't boil it again. I just rinsed it and put it back in. And I was careful actually not to use soap, because if you use soap on this, you would get a yeast infection. So that was heavily a no-no. So you would just rinse and put it back in. And then at the end of your cycle, you would boil it again and put in a plastic bag to wait until your next cycle. But I think nowadays, I wouldn't do it. I mean, I've heard this thing about Staph and Staph aureus just being in the environment is quite frightening to me, because I remember having a patient who told me that her husband had fallen on the street, just tripped, and he cut himself. And he actually, I don't even think he cut his pants, but he did do something to his skin, even through the intact fabric, tore the skin, ended up with Staph aureus infection, and needed 3 surgeries to deal with that. And if you think that Staph, so let me just say the difference between Staph and Strep. So staphylococci are little round cocci bacteria, and they grow in clusters. That's Staph. But Strep, like that causes strep throat, and streptococci are little round cocci bacteria that grow in a straight line. So that's the difference, Staph and Strep. But Strep can also be a cause of toxic shock, not usually the toxic shock that's related to tampons, because that seems to be Staph aureus. But streptococci can also cause toxic shock syndrome, and with some of the same signs, because it's still toxic shock syndrome from an endotoxin, from a toxin, from the strep. And actually, I had a very interesting case of a patient once who presented with an incredible pelvic cellulitis. She wasn't yet going into shock, but she was close. So cellulitis meaning the tissue itself was totally inflamed, beet red. She had a high fever. It was crawling up her belly even, but it started in her genital area. We got her in the hospital and had an infectious disease specialist take a look at her. And it turned out that it was strep, a strep infection, a strep cellulitis, and it was moving towards a real toxic shock syndrome. She was going into shock, but luckily we caught it in time. But it was caused by her husband, who had gone down on her, who had performed oral sex on her, and he had strep throat. So you should remember that strep throat is group A strep, and that is a cause of very serious infections. So just don't have sex when you're sick. Just take care of yourself. And I'm sure that neither of them expected that this could happen, but it certainly did. So, all it takes is little tiny tears in the tissue, and the mucosa is very sensitive, and bacteria get in, and then these bacteria can create these toxins and create a huge cellulitis and infection in a short period of time. So
I never had heard of the sponge, but I remember receiving at school, they gave us these they looked almost like a Dixie cup, but it was clear plastic and very flexible. and you would kind of squish it together and insert it up, and it would collect the menstrual blood. And I thought, that is just disgusting, that you're collecting it in a cup and then you would rinse it out. I never used that, but that was one of the alternative things I remember.
That's so interesting, because I don't remember that, but that's back. That's called the Diva Cup, and a lot of people are using them as an alternative to tampons, and I believe they are safe because they certainly don't have any absorbent fibers, and it's just a plastic cup. So the Diva Cup.
Yeah, but I'm wondering about the plastic, and is that as you're starting to, because your body could possibly be leaching some of these, the plastic toxins out, and I'd be concerned about that because, your body is warm, close to 100 degrees. So I'm just wondering about the plastics, and because you're putting that in for long periods of time.
Well, I guess you could decide, but it's interesting. I don't really know. I was growing up in the 60s, right? We had family friends who were a little old fashioned. Again, this is back in the day, right? Because I really date myself. I'm 60. But so we had some friends.
Me too.
They were a little old fashioned. And I remember that those young women, they were a bit older than me, they were using rags as pads, just rags. They didn't buy pads. They were using rags and then washing them out. And I know probably in many places in the world, people are really still using that because they don't have access. And the question really is the way we progressed, is what we're using now safer? I certainly see so much inflammation of the vulva because of whatever chemicals are in some of these pads, especially mini pads. Those panty liners. It's almost once a week when I was in private practice, once a week or more, that I would see, especially a postmenopausal woman, but not always postmenopausal, who developed an irritation from some combination of dryer sheets and scented detergent and bleach and sometimes but often a combination with those mini pads or those panty liners that are bleached. So I tried to tell people to use the unbleached pads, but the Diva Cup I know is popular, and I don't really know whether anyone has looked at whether any of the chemicals in this flexible plastic, the plasticizer stuff that we believe we know are endocrine disrupting chemicals, whether they are leaching out into our bodies in a significant way. But it is a concern. But then what are you supposed to do?
I don't know. I wouldn't be going back to the sponge. I'm just glad I'm past that point, but so I don't have to make these choices, because honestly, I mean, when you start to think about how toxic some of these things can be, it's kind of scary, that our women have to make these choices. And, is it better to use a pad, or is it better to use a Tampax? And then I also think, is the question, if somebody uses the Tampax, are they still a virgin? And there's all that question as well.
Is that true?
Yeah.
I've never heard of that.
Okay. Perhaps not in this culture, but there is that concern in some cultures whether she is a virgin or not. And
oh my gosh.
So that's also a question. But I mean, I also know, I just remember back in the beginning that it was not pleasant to use those in the beginning. You had to learn how to put them in, and it wasn't pleasant. But I just think about, back now that I'm reflecting back at, in the day, how much, and how long, because like you forget, I mean, that you had it in there until you started leaking all over the place. And, and sometimes you might forget that like you said, you didn't fish it out. I've done that. I have, I admit, and you're like pulling something out and you're like, wait, there's something else. Wait. And, and you're like, oh man, how long has that been up there? And I don't know. I'm so glad that I was able to survive those days, because I did use tampons, and now I reflect back about how bad, what was I doing to my body?
No, you didn't. That's so interesting. No, I definitely did. I mean, the pads do you remember how so you were given that cup? We were given back in, 8th grade, whatever 7th grade is, 6th grade, I guess, when they made us watch that film, and they gave us these huge pads. And then do you remember a strap, a little, like a belt?
Yes.
The belt with the little hooks, and then you'd have to, oh my gosh. And it was just this huge thing, but Yeah, I remember the first time when I got my period and wanted to go swimming. And so you had, if you're going to go swimming, you had to use tampons. And it was,
Yeah.
I ended up having, my mom took me to a doctor because I was so nervous. I had that vaginismus thing. I didn't even know what that was then, but I just couldn't possibly push anything through that wall. I was so terrified, but swimming. So this, I was wondering, we talk about all the different options you have. Well, one option right now is the long-acting contraception of like that Paragard, not the Paragard because that gives you heavy periods, but the Mirena IUD or the progestin-containing IUD, because a lot of women use those. They're good there's some that are small that are good for 3 years. There's some that are small that are good for 5 years. And there's some that are regular size that are good for 5 years. So there are a few different kinds of these progestin containing IUDs. The Mirena is a very common one, and it emits a little bit of progestin just to the lining of the uterus. And most women within a year or less stop bleeding altogether. And so you could go years without having to worry about tampons.
Can that be good for you?
Yes, actually, because it gives you a little bit of progestin, so it actually would lower your risk of uterine cancer, and it's
But you're not going through the cycle of bleeding.
Right. You don't really need to, because the progestin is acting on the lining to make it super, super thin. It's not like having polycystic ovarian syndrome where you actually are not ovulating and you're just having a lot of your own endogenous estrogen acting on the lining to make it super thick, and it's not being balanced by any progestin. That definitely leads to increased risk of uterine cancer and hyperplasia. But in this case, when you're using these progestin IUDs, this constant low level of progestin just to the lining does not allow there to be any. As a matter of fact, when women, perimenopausal or postmenopausal women, develop some hyperplasia, one of the treatments, they can take progestin for 3 months and then recheck a biopsy, but you can also put it in a progestin IUD. So that progestin will actually reverse any kind of hyperplasia type changes. So now the one concern about IUDs actually is the other one, the Paragard, because the Paragard, which does not have progestin, has a little bit, a coil of copper. And I don't really know why they added it. Probably because it does add because it's there and it causes even more inflammation, sort of low level inflammation. Because one of the ways that the IUD works, because it doesn't affect ovulation the way birth control pills do, it affects implantation, the ability of this new embryo to implant. That's why some very staunch, Christians who don't believe in any form of abortion actually feel like IUDs could be considered an abortifacient because because it doesn't allow implantation, but then the embryo would just flush out. The copper is a bit of a concern because, as you know from talking to Neil Barnard, right? Copper is one of the metals that can accumulate in the brain and be associated with Alzheimer's and dementia. So there is a concern that maybe there's a very small amount of copper that does get leached out. I remember doing a little bit of research, with him and talking to him about this, and it's sort of buried in the literature, but there were some studies that did show that there was a small increase in the blood levels of copper in women who are using those Paragard IUDs. So, there are other reasons that I might not really recommend the Paragard, also because it causes heavier bleeding and more cramping. And with my history of such heavy bleeding, I would not like that whatsoever. But there are certainly the benefits to using the Paragard, and that is that it's good actually for 10 years. That's a long time, right? Yeah. So if you're 20 and you're, going off into the world and you just want to do your job and not have to worry about, and having friends and lovers, and you don't want to have to worry about getting pregnant, then for a long time, for 10 years, then especially if you have very light, painless bleeding, that would be something to consider. But other than that, I think that the benefit of a progestin IUD, and I know, I'm a traditional OBGYN. So if you talk to some naturopath or something, you might get a different answer because they may not be in favor of putting a hormone, into your uterus at all. But I am a traditionally trained OBGYN. And so I think it's a wonderful benefit of not having to deal with your periods. And a lot of women do like that. And it is considered safe. There is a slight increase with any of these IUDs because they work by preventing implantation. Although the progestin IUD also works partly by interfering with ovulation, partly by interfering with the way the tubes move. But you are more likely with any IUD to have a tubal pregnancy, an ectopic pregnancy, a pregnancy that's not inside the uterus. So, but the risk of pregnancy with the progestin IUDs, because of, it thickens the mucus in the cervix too, so it impedes the sperm from getting up, keeps the sperm from getting up to the egg. So there are all those different ways. The chance of you getting pregnant at all is so low that the chance of an ectopic is also very, very small. A little higher with the Paragard. Yes?
I just want to circle back to the copper and explain why to people if they're tuning in, what is the issue with the copper? Because don't we need copper? Well, yeah, we do, but it's one of those micronutrients, and it's one of those things that if you're getting too much of those, and it's the metals like copper, it's iron, we need that too. Yes, we do. But if it's too much, again, these things are causing issues. Or zinc. Zinc's another one.
And aluminum.
Yeah, and well, that's another conversation. But going back to the copper, what happens is your body, when you get too much of it, and it's going to stay in your fat cells, your body puts a coating of fat around it to protect you, very much like an oyster puts a coating around a grain of sand, and that's what eventually becomes a pearl. Well, that's something great, but that's not great in our body. Let's just say this layer of fat goes around the copper, and what happens is you start getting these plaques in your brain. And in the beginning, you can kind of go around these plaques because you still have other neural pathways that you can get to. Like if you're trying to get a memory, like, what was the name of that guy? I can't remember. What was it? And then you remember. Okay, but eventually you're getting so many of these blockages that you're like, yeah, I have no clue. And you can't remember. And that's scary. And that is the beginning, that's Alzheimer's, right there. So that's one of the issues and why we need to be very, very careful about the metals in our body, especially and particularly zinc, because as we're coming into this cold and flu season, there's all these zinc tablets, zinc. That was all the big craze. And zinc in particular is extremely oxidative in your body. And so you want to be careful about that. But just circling back to that, copper, having copper in there, and that's why I'm concerned about the plastics in those cups. If that's what is happening there, if it's happening with copper, I'm wondering if it's happening with that plastic too. And is that something that, I don't know what else to tell you, ladies. I mean, about, what are your choices and please make sure that you're using something that's like a little bit of the organic. If you can find USDA certified organic, I don't know if such creatures exist out there, but you want to make sure that you know where the fibers are coming from that they're making this with, that you want to make sure that there's no toxic chemicals in there. So that's my big thing.
There are, because I worry about the bleaching process also.
Yeah. I
really would buy unbleached and organic pads if you can get them. I think you can. I forgot which company there is. I think it's a yellow box, but anyway. And think about, you can think about the IUDs, the progestin IUDs, because it can be helpful. And also being on a plant-based diet is definitely going to reduce the estrogen. Using your tablespoon of flax also every day is going to reduce the levels of estrogen in your body. Maintaining a healthy weight and not becoming overweight or obese is going to help also, because your fat cells are little estrogen factories. And so you want to keep, help. That will also help hopefully to minimize, the blood flow and the risk of PCOS and endometriosis. But some of these things are pre-programmed into you, and it's not your fault. Moms could have been exposed to obesogens and chemicals that could cause you to become more likely to become diabetic through epigenetic changes. So, cut yourself some slack, take a break, but just do what you can.
All right. Well, Debra, thank you so much. As always, you are like a fount of knowledge,
So are you. Thank you.
All right, ladies, we'll see you back next Thursday at 2:30 for more topics on women's health.